Ever wondered about the fascinating process of stem cell transplants? If so, you're in the right place. Stem cell transplants, a remarkable medical breakthrough, offer a glimmer of hope to many people worldwide, particularly those grappling with cancer. Imagine your body as a bustling city, and blood cells as the workers keeping everything running smoothly. Now, if some of these workers were to falter, the city would struggle. That's where stem cells come into play. These are young blood cells with the potential to grow into different mature blood cells. They act as a reserve army, ready to replace any faltering blood cells. In certain situations like cancer or its treatment, these stem cells can get destroyed, hampering the smooth functioning of our body. That's when a stem cell transplant might be needed. This process essentially replenishes the body's stock of stem cells, allowing it to generate healthy blood cells once again. Now, you might be wondering where these replacement stem cells come from. Well, they could either be the patient's own previously collected stem cells or they could be donated by another person. The latter option, of course, requires a suitable donor. There are two types of stem cell transplants. The first is autologous, where the patient's own stem cells are used. The second is allogeneic, where stem cells from a donor are used. Each has its own advantages and challenges, and the choice between the two often depends on the patient's age, health, the type of cancer, and the availability of a suitable donor. But stem cell transplants aren't simple procedures. They require high-dose chemotherapy and sometimes radiation therapy, so patients must be healthy enough to undergo this intensive treatment. Side effects are common due to the effects of the treatment on the bone marrow and body. These transplants are performed in specialized treatment units, and patients often require frequent hospital visits for several months after the procedure. But for many, the possibility of curing or controlling their cancer makes this rigorous journey worth undertaking. To recap, stem cell transplants replace stem cells destroyed by cancer or its treatment, using either the patient's own cells or those donated by another person. There are two types of transplants, autologous and allogeneic, and the procedure requires intensive treatment and could lead to side effects. Despite these challenges, stem cell transplants offer a potential lifeline to many cancer patients. So there you have it, the intriguing world of stem cell transplants, a revolutionary procedure that's transforming lives across the globe. But what if there was a simpler, less invasive alternative to these procedures? Imagine a world where stem cell transplants are as easy as swallowing a pill. This is not science fiction but a revolutionary concept in its nascent stage: stem cells in capsules. Compared to the traditional, often grueling processes of cancer treatments and transplants, stem cells in capsules could be a game changer. These encapsulated stem cells could potentially be ingested, bypassing the need for invasive surgeries. This means no need for donors, less time spent in hospitals, and fewer side effects due to the targeted nature of the treatment. Stem cells in capsules, a revolutionary alternative that could change the face of cancer treatment and potentially transform countless lives. As we look towards the future of medicine, the possibilities seem limitless.